Hi, everybody. Welcome to the November edition of the Golden Crescent Regional Recovery Initiative. My name is Charlie Boswell. I am the program coordinator for Victoria and the surrounding counties on the HRSA grants. And today we have a special guest, Mark Kelly. He's been with us before. He is an LCDC counselor over at Billy T. Cattan. He spoke at the symposium. He's done one of these before, and he's going to give us some new information, I hope. I don't know of any announcements that need to be made at this time. I would like to say that the holidays are coming, and the holidays can be brutal for people in recovery, or just anybody, I guess. A lot of people are prone to seasonal affect depression. They have family issues and different things going on. And for a lot of us, the holidays are a good thing. For others of us, they're difficult. And for others of us still, they're just a mess. And a lot of people relapse during the holidays. They get isolated. They start feeling lonely. And, we just people in recovery need to make themselves available. And I give my phone number out to a lot of people. And, hey, if you're feeling down, call somebody. It's a whole lot cheaper, and you'll feel a lot better at the end of it for having done so. So I just wanted to throw that out there. And I'm going to turn this over to Mark. I'm going to stop sharing, and Mark, you can hit share and share your screen, and we'll get going.
All right. Thank you, Charlie. Let me see if I can do there we go.
Yay.
I threw this together really fast, so you'll have to excuse its look, but my name is Mark Kelly. I'm a counselor at Billy Cattan Recovery Outreach in Victoria. We're an outpatient treatment center. We treat substance use disorders. We diagnose and treat substance use disorders primarily. We are also are fortunate enough to be funded by HHSC state agency, and so we are able to provide services free of charge for most people who come in the door. So we're able to provide that for people. It's also really exciting times for Billy Cattan. We have expanded services to recovery coaches, which is a really tremendous resource for people. A recovery coach is someone that can actually go into the community and provide kind of almost like a case manager service for a person who needs support, who might need a way to get to a meeting, a way to get to an appointment, or somebody to call. It's kind of a go-to contact, and it really expands the it expands the solution. We're also building a residential treatment center. It's going to be part of what we're going to be doing in the next few years. And I know you guys probably already know all this, but it's something I've been thinking a lot about. To me, a residential treatment center is it's like a hospital. It's a place where people can go, can separate themselves from their environment and detox and learn about what recovery is all about. And I think that's really important for me. And what I like to think about and how I conceptualize it is building a community. What I see happening through what we do at Billy Cattan is an opportunity to build a recovery-oriented community. And I think that addiction, when we describe the problem of addiction, it's a really complicated problem. There's not an easy way to think about what addiction is. So much so that the word addiction is not in the diagnostic manual. They've kind of given up on it. And they'll say because there's a stigma attached to it and there's a negative connotation to the word addiction or addict or alcoholic or alcoholism. But But I think that because the word addiction is such a broad term that can encompass so many different things, that it's just kind of like taken away from the diagnostic language. It's not a technical term, but it's obviously something that is very real. I did a talk on the cycle of addiction. I've been doing this talk for a while. It really is interesting to me. It's my job to think about what addiction is, because I think that when you understand something better, then you can approach the problem from a better perspective. You can approach it with a compassionate perspective. You can make a solution. If you don't know what the problem is, then it is difficult to come up with a solution. And I'm not a medical doctor, and so I there are medical solutions to addiction, but it's not, there's no silver bullet. You can take someone who is addicted to alcohol, for example, and give them a sedative, and that can mitigate withdrawal symptoms, and you can detox that person and they can be sober. But if you don't address a lot of the other kind of issues, the more complex issues of addiction, then you just have a sober alcoholic. And then the chance of them relapsing is like, 90% or something. And the rate of recovery too. The rate of recovery is not very high. Even with all of the modern kind of advances that we've made in treating addiction, the long-term sobriety is not very high. I think I've seen it like 10% or something. And so you have a pretty reliable rate of about 10% of the population that kind of falls under this substance use disorder umbrella, which is 30 million people in the United States. Is a lot of people. And then maybe 10% of those are going to recover. And it makes me really want to think about it or conceptualize it in a different way. I start with a question, and I've been dealing with clients with addiction for a long time. I've been doing this job for about 10 years now. And what really strikes me, and I think what has always struck me about addiction, is that the way that people will choose their addiction over anything else. And it's particularly striking when you have parents. I've worked with a lot of parents that have children, sometimes young children. And you will see these parents who love their kids, and they'll say they love their kids. And I believe they truly love their kids with all their heart. But when having to choose between getting high and losing custody of their kids versus staying sober and then keeping their children, like those are the choices. So many times parents will choose getting high. And so that was really like the big question that I have. Why the hell would someone do that? Why do people act that? How do you approach that from a rational thing? Because we can write off people with addiction as just insane people, which they're not, or just bad or evil people, which they're not. Or we have to think about it and come to a logical understanding, because there is a logic that comes with addiction. There is a rational, logical reason why somebody would choose to get high over anything else, because the choice becomes so compelling to them that the consequences of not using are terrifying. So, and that being said, I've kind of thought about this cycle of addiction, because I do think that addiction is more than just a problem of an individual person. I don't think that there's any kind of problem that people have that only exists within them and is not influenced by other people, because we exist in relationship with other people. And so on this cycle at the top, where it would kind of start, you would have a child born with a genetic risk factor. And I think, and I'm not a geneticist, I'm not a scientist, so I don't really know, but I do know that there are genetic markers that make people predisposed to certain kind of addictions. And there's probably personality traits that make people more susceptible to the kind of the temperament that would predispose them to addiction. And so basically you would have a child born with the genetics and with the right temperament. And then you would have this child in a dysfunctional family. And then that child would experience trauma of some kind, whether that's big, it doesn't have to be big trauma either. It doesn't have to be abuse and neglect, but oftentimes it is. But something will happen to a child when they're young that they will feel this kind of rejection of themselves. They might, maybe they're bullied in school and they come home and they tell their parent about it, and their parent is like, no, you're stupid, you're weak, you got to just pick yourself up, you don't need to talk about that. And so they feel rejected. Or maybe they are abused by a family member and then the family chooses not to believe them. And so as a child, when that happens, if your parent doesn't think that what you're saying has worth, as a child, you will it's easy for a child to believe, well, because my parent doesn't think that what I'm saying has worth, then it must not have any worth. Then what I feel, therefore, is not good. Children will see their parents as an extension of themselves. They can't really differentiate. And so a rejection from a parent is like a self-rejection to a child. And I think that kind of experience in the developmental years, adolescence, up to teenager, will create this chronic kind of isolating feeling in a young person. And when that happens, then kids are more prone to being socially awkward, or maybe they're more prone to being bullied, or maybe they're more prone to becoming bullies themselves. They're children who are raised in a dysfunctional family are pushed kind of as outliers in the social setting. And so then whenever they are in their teenage years and everybody is experimenting with drugs and alcohol, which is a normal part of being a teenager. I mean, teenagers are going to be exposed to substances inevitably. Those particular kids, when they use, it becomes such a effective solution to that feeling that it becomes irresistible. And so drugs and alcohol are such an effective and easy and convenient solution that those kids who have such a high risk are going to kind of immediately be drawn to it. And this is before there's any like physiological change, because I don't believe addiction is just a physiological change caused by a substance. I don't think addiction is really about drugs and alcohol at all. I think the drugs and alcohol are just a convenient solution. And so then as those people begin to use more often, then there is a physiological change that happens from the presence of a drug, which kind of creates its own little cycle, like if I'm using drugs every day, then I'm probably not working or not holding a job very well. I'm probably fighting with people in my life. And so I'm becoming more and more isolated. And then I'm using to try and solve that problem. So it's like a snowball. And then I'm going to kind of like surround myself with other addicts, because that's what we do. Like, I don't really want friends who don't use drugs because they don't have drugs. And so it becomes this like this little world. And I hear clients tell me all the time, it's so funny. Clients will be like, everybody uses drugs. Like, they'll literally tell me that. Everybody drinks, everybody uses drugs. And in my mind, I'm like, and I tell them this too, I'm like, just because everyone uses drugs doesn't mean that literally everyone in the world does it. But because they have kind of made their world in that lifestyle, that's just who they know. And so then those people will get together and they'll have romantic relationships, and then they'll have kids. And then they'll pass that dysfunction on to their children and raise them in a dysfunctional environment, and we'll begin all over again. So that's kind of the cycle that in a nutshell, how I conceptualize addiction from a perspective of a counselor. And there's a lot of other perspectives to it, but this is the one that I use in my capacity. And so for recovery, I've been thinking about the residential program a lot. I'm convinced that the only way we put a dent in the problem of addiction is to build a community. And this is really kind of encapsulated in the wisdom of Alcoholics Anonymous or any of the other anonymous type of programs. AA works because it's a community. It's not a self-help. I always kind of cringe when AA is described as a self-help group. It's not a self-help group. It is a we help each other group. And that's why it works. It is a process of finding value in, overcoming the shame of addiction by finding that it actually has value in helping other people. That's how people recover, because in helping other people with the addiction, I use my addiction to help another person. I'm now connecting. I'm becoming less isolated. And I'm finding my self-worth again, and I'm making friends. And now all the people I know are sober. So that it really kind of flips it around. I wrote this, and I wrote this in thinking about how a residential program can work and build a community. And so, basically you would have someone like, let's say you just have Joe Blow off the street, and he's a drug addict. And he comes into a residential program. And so, I'm nervous. I don't know what to expect. I'm put into a group. I'm expected to talk about, how I feel, which is hard because I'm probably a very secretive person and a private person. I don't want people to know my business. Maybe I've been hurt. As I talk about the way that I feel, as I share, I will begin to build trust. And I will have other clients who have been in the program helping me get acclimated to it. And so already you have people, people helping each other. That to me, that's the whole theme of recovery, is one addict helping another. And then as I go through like a program, what I'm hoping is that a residential program can be based in a 12-step model, because I really believe that a 12-step model is what builds a community. I think that is the unique aspect of it and why it has persisted for so long. What you'll have basically is like me, if I'm a new patient in a residential center, then I'm doing step work. And then I'm having people who have already completed the program, who are out there living in the sober living house or out in the community, coming and helping me finish the work. Like they're hearing my, part of the step work is like talking about an inventory and doing all this kind of stuff. And then as I go along, the idea is that I will become an alumni of the program and then help the new people who are coming in. And to me, it fits nicely into this idea that addiction is a disconnection from other people and a disconnection from the self. Johann Hari, and I don't really know much about Johann Hari other than he gave TED Talks about addiction. You can look him up on YouTube. But Johann Hari said that the opposite of addiction is not sobriety, or abstinence. Abstinence is not the opposite of addiction. You can be abstinent from a drug and still have every symptom of addiction that there is, other than the drug use. But he said that the opposite of addiction is connection. Because if the more a person is connected to other people, the less shame they feel, the less isolated they feel, the more worth they feel that they have, and the less likely they are to turn to a substance to provide the relief from those symptoms. And so I see an opportunity in having a residential program, having an outpatient program for people to go to after residential, attracting sober living homes, having a network of local providers who can help people meet basic needs, because that's really, really important too. Psychiatric care, housing needs, employment, there's quite a few resources in locally here that we use a lot. Community Action Committee and Gulf Bend and Texas Workforce, those are all really good programs. So there's a really holistic kind of solution to this. And so this is going to lead me to what I wanted to talk about, which is a podcast. And I don't know how it relates to it, but I want to talk about a podcast. Because a lot of what we talk about is stigma. There's stigma of addiction. There's stigma everywhere, and I really think there's only stigma if we don't talk about it. It's not normalized. Addict is not a bad word. It only has a negative connotation in certain situations. If you go to an NA meeting or an AA meeting and everyone there is like, I'm an addict, I'm an addict, I'm an addict, they're not downing themselves, but there's a reason why people do that, because it normalizes. Hey, it's okay. It's okay to have that problem. We all have that problem. Now let's do something about it together. It normalizes it. There's no way to bust through shame and stigma. You have got to normalize it and have people feel safe about talking about it. If somebody feels safe to talk about something, they will not feel shame about it anymore. Because that's what shame is. Shame is a feeling of threat, I am threatened by exposing a part of myself that I think people are going to reject. That's what shame is. And that's what children feel when they're rejected by their parents, and they carry it all the way up into adulthood. And so in the effort to normalize this situation, make light of it, talk about it, we have had, I have an opportunity with our recovery coach, Skip Mosachek, who is very connected to a lot of kind of marketing stuff and building things and doing making things. He's good at making things. He's like, hey, Mark, let's make a podcast. I'm like, let's do it. And so and honestly, I don't know much about this ROSC. I'm kind of unaware of the ROSC and a lot of who you guys are and what y'all do professionally. But I have a feeling that if we had a podcast and we invited one of you guys onto the podcast, you'd probably have something good to say. Because I imagine that you guys are kind of in this world somehow, either medical or research or, So I really wanted to just throw it out there. And maybe I didn't even put my contact information. I think Charlie might have it. I don't know if he can put it on the screen somewhere. Let me chat it. My email address is this. If you are a person in the field where you are thinking about substances or medical issues or harm reduction issues or issues with, I know that there's been some talks about fetal issues and pregnancy. Those are all topics that I really, really want to talk about on a podcast in depth. Because there's so much to this problem. It really, it's everywhere and kind of in everything. And so I'm really trying to kind of like network with some of you guys with the intention of having a real discussion about, you know, maybe we can invite one of you on for like a 10 or 15-minute podcast. And this is an idea, honestly, guys, like if someone came up to me and was like, let's make a podcast, I would probably roll my eyes and I would be like, you know, that sounds nice, but we're going to have like 10 listeners and it's probably going to be like my mom and, you know, my girlfriend.
Mark, I will say I'm very I like the idea of a podcast. And just to introduce myself, I don't think I've met you before, but my name's Isaac. And I'm with the telebehavioral care program. So I'm a psychologist. I kind of come in working from trauma first. But you know, that was like kind of my forte, working within the VA. And in the VA, they kind of separate substances before you work on trauma, which is this kind of unique thing in counseling, where and as you know, they go hand in hand. There's trauma, it's trauma based, I believe.
You cannot separate
right.
addiction and trauma.
It's so hard to.
You can't put them in these little neat things because they are webbed together. One influences the other, and it kind of cycles itself.
So I've kind of dipped my toe in the past 3 or 4 years into more focused substance abuse treatment. And that's something that the more and more I do it, the more I notice that, you know, they're kind of the same thing, just veiled in a different way.
Absolutely.
And one of my fortes is just kind of the use of skills like mindfulness or other skills like social networks or community-based type of interventions, of utilizing those to increase our healthy way to react to basically like the bad shit that happens in life, you know, and the better we are at being able to engage those resources, the better we are at not turning to a substance, which just has it's the easiest way to deal with something in the moment that's super difficult. And if you don't have the skills, and if you grew up in a family that doesn't teach you the skills and also has their own kind of things going on, also some genetic things like you were talking about that probably increase the chance of us being or leaning towards certain addictive habits.
Right.
You know, there's a lot of complexity to, but I just did want to mention, you know, like there's, I would be super interested. Again, you know, if your mom wants to hear, if my mom, you know, like whoever's listening, I would definitely be.
I bet our moms would love to hear it.
Yeah. Right. I already bent my mom's ear about some of the stuff, but yeah, I would definitely be interested. If that's something that you, there's more of an interest, at least for me. One of the things I've tried to do a little bit more is be a little bit more engaged in social media / kind of increasing my engagement in those platforms naturally. There is at least for me, my personality, I shy away from like radio things or any kind of little, you know, thing like that. But there is definitely a need for us to continue to increase community aware. If there's people that we can, at least one person that understands a little bit what addiction or what mental health issues their families or themselves have. And if we could do that by stepping out a little bit more and being, you know, creating a podcast or doing something that's a little bit more created for other people outside of ourselves, because I feel like, in this community of healthcare professionals, we definitely kind of get it, right? We understand a little bit more, but to increase the awareness of maybe the lay person on what maybe their cousin or mother or brother is going through, and that increases that sense of community that you were talking about.
I think that and I really, really appreciate that, Isaac, and really like everything you said, like that's our podcast episode right there. You have different professionals have perspectives on the problem from their own unique experience. And also people who are in the world of recovery, or people who have been to prison, people who are who are veterans, like everyone has a story to tell. And I want to be able to kind of tie that into the broader issue at large, because the issue of addiction is, like you said, it is very complex. It is more complex than a diagnosis. It's more complex than a medical treatment or a counseling session. It's a human being. It's a human condition and I think it's best told in the stories that people have.
Well, I think even like this, Ross, like the diversity. I had never worked with nurses and Jody and all the team that now that I'm on, kind of working with the ARCOR folks. I definitely have increased my understanding on different professions and how they approach addiction, and how those things are kind of come together. Because I think the more diversity we have, the more people we come to solve this problem, the better
100%.
chances we have at understanding, and providing support to those people. There's definitely one of the major things that I really try and you talked a little bit about it, but what's that word? The stigmatization of addiction, and what that means is so different across the board, but everybody definitely deals with the stigma of addiction, and how we address that in communities, how we address that individually is definitely our cross to bear, because we need to be able to have more open forms of communication and talk about normalize this, because it is a human condition. It's been going on for a long time, and the more we gain ground and really kind of promoting a society, a community that is more wise to why these things happen, and understanding of the human condition, because that's really, I feel like the basis of it. We're all in the same boat. We are human beings, and we go through this thing called life, and to provide each other with the support and understanding that sometimes addiction, it can be it's a symptom of something else greater. It's not
exactly
the problem itself.
That's exactly right.
Right.
I truly believe that. And I think if the more we promote that idea, the more appropriate a response I think people who are in an addict's life will have to them, because it's not a disease the way cancer is a disease,
Right.
It's more of a disease like a shrimp allergy is a disease, but then the person keeps eating shrimp like after they end up in the hospital over and over again, and it frustrates every person around them, like, why are you doing that? If we can understand a little bit about why someone would feel so compelled to choose this behavior that's literally destroying them over everything else, if we can have compassion for that person and have a compassionate understanding of what drives them, then we can really help that person feel, and I don't know, to feel safe enough to get help. Because they're not going to just think, well, I'm a bad and a weak person, because that's the voice that's fueling the addiction in the first place. And people around them are reinforcing that by saying, yeah, you are a bad and a weak person because you can't stop. So it's, you kind of like shatter through that kind of response to it. And you are going to have people who are more likely to make the phone call, to have more hope that, hey, this is a problem that has a solution. There's a solution to addiction. It's just not that many people choose it because it seems so remote and distant, unless you start knowing people who have done it before.
Right.
So to me, it's about exposure. It's exposing a solution and having having a good time. And Skip is he's a remarkable person. Like, he's really, really cool. He's funny. Like, we want to make it entertaining. We want to bring people on. We want to make fun of ourselves. Like, I really think it can be an interesting thing. So that's kind of just wanted to throw it out there like that. And I appreciate you guys for your patience and letting me share today.
Thank you, Mark. I want to jump right in. Daniel made a comment to me a couple of months ago. All the major recovery centers, residential treatment centers, are generally 12-step based. Now you have the ones like Passages, and they're going to do something else, but La Hacienda in Kerrville, they have an annual reunion that sells out the Anne of the Hills hotel, and people go to that. They come from Europe to go to that. They come from Canada. They come from all over because they recovered in Kerrville at La Hacienda 30 years ago. And they come back and see all their old friends and meet people. And I've been to that hotel. I don't know how many rooms are there, but it's pretty spread out, and for a group of people to be that dedicated to coming back and celebrating their recovery, and their families have maybe gone through there. They've recommended someone that went through there and got well. That's a testament to the fact that the deal about the 12 steps is they take you somewhere. They take you from where you are now to a different plane of existence. And it's not, they say it works if you work it. I don't think it works if you work it. I think, or it works for people that need it. I think people have to really want it, and they really want to change. Isaac, I've said it before, the old joke about how many psychiatrists does it take to change a light bulb? Just one, but the light bulb really has to want to change, And so people that do the steps, it transports them to a different plane of existence in their life. Doesn't have to be religious at all. It doesn't have to be even that spiritual. But you do have to kind of go through that process to understand it, and then turn around and help somebody. It's not till the 12th step that, having had a spiritual awakening, we tried to help others recover from alcoholism, And this weekend in our city of Port Lavaca, they're having a Unity Day, kind of like that alumni deal, where everybody's going to come together. We're going to have food. We got speakers lined up, all those kind of things. People come to those kind of deals to feel that community and that
right.
connectedness.
That's right. That's absolutely right.
And there's a group also in town that every Thanksgiving and Christmas, it falls on a non-Sunday, they provide a ham and turkey and invite everybody to come and bring side dishes and whatever. They have their regular meeting, and then everybody goes across to the fellowship hall and has their Thanksgiving dinner in a non-judgmental, the safety of, I used to say my family used to put a lot of distance between them and me, and now I put a lot of distance between me and my family. But, and last thing I'm going to say, and then I'll shut up. We've got a few minutes left. I'm putting something in the chat. This is something I just happened to watch, and oh man, I wrote it down. Oh, Netflix, Murder to Mercy, the Centoya Brown story. If you want to see this cycle of addiction in families, watch this. I'm not going to give any spoilers. This poor girl has it all over her from the minute she's born, and she grows up in that, and how it changes her life and impacts her life, and how it changes other lives. And there's everything, and then right in the middle, they introduce some stuff in her life that happened that, you would look at those markers and say, she never had a chance. She never had a chance. And she ended up getting life in prison for some stuff, and I'll let you all watch
Spoiler,
that.
Charlie.
it's, people that, and I've talked about adult children of alcoholics on here before. People that grow up in this stuff are far more prone to it. They don't want to, I said, I don't want to be like my dad. I'm never going to be an alcoholic. And, fast forward 30 years and, I'm going through divorces and bankruptcy and everything else, it's just understanding. And Mark, we are a recovery oriented system of care. By virtue of the fact that we have people on here from all the different agencies and stuff, and that's exactly what we're trying to do. Billy T is a big part of that, and $9 million to go. We will build a residential treatment center with a 12-bed detox unit, and we'll increase the availability. I look at it as awesome service opportunities. There'll be opportunities for people to go out there and conduct meetings. And,
Yes.
For sure.
And bring in people from the outside to talk
Yes.
about their experience and what happened and what they're like now,
Yes.
So it's all good. We've got 3 or 4 minutes left. If anybody would like to share. Melissa, how are you doing today?
Great. I really, really enjoyed that presentation. I haven't exactly viewed it in that way before, and it really, really resonated with me. And, I am a person in long-term recovery myself. And so, I was just kind of on a personal level, just tracing, like, oh, this is when that happened, and this is when that happened. And that's why I did that. Okay. Because I've had a hard time making sense of it in the past, and it does make a lot of sense. So thank you so much for the presentation. And I also think a podcast is a great idea. I know lots of people that would love to do that. So
I appreciate that. Thank you so much.
yeah. And I copied down your email address too. So I'll send you my contact information.
Please do, Melissa. I would love to have you as a guest and tell your story or whatever it is you're comfortable. We can discuss that, but I really want to make this about people's experience, either professional or personal or both,
Yeah. I was thinking of my friends that aren't as shy as me, but maybe I could do it too.
We'll see. But, thank you so much.
Yeah.
Well, I'd like to thank everybody for being on today. It's a small group, but that's where some of the best ideas are generated. Reach out to Mark, myself, Isaac, certainly, Lawrence with Gulf Bend down there, and we've all got something to add to the discussion. And if you would like to showcase your agency or organization, we'd be glad to reserve a space for you on this. The second Wednesday of every month from 12:15 to 1 p.m. My name is Charlie Boswell, and thank you all for participating today. Great session.
Mark,
Bye-bye.
I'm going to be in touch with you and Isaac, and I'll copy Melissa so you have Missy's email on there.
Thank you so much, Jody.
Yeah.
Great. Thank you.
Take care.